All right. Thank you, everybody, and greeting respected judges, professors, and colleagues. Chronic wounds. Chronic wounds pose a major healthcare burden worldwide, whether be it clinically, economically, or even psychologically. It's even estimated that around 1 to 2% of the population in developed countries suffer from a chronic or experience a chronic wound over the lifetime. This burden becomes even larger when the wound is present over such an area as the Achilles tendon. So this is due to the relatively poor vascularity, and of course I'll come to that later. However, in general, healing is usually notoriously delayed over Achilles tendon. Today I present a case where hope emerges, and using modern technology and wound care, we can achieve great results. So our patient is a 50-year-old male. He was non-diabetic, non-hypertensive, and on examination, he did not show signs of peripheral vascular disease or systemic sepsis. So no major side effects that could pose a threat to wound healing. However, the anatomical location alone presented a significant challenge. This is because the Achilles tendon is again characterized by relatively poor local circulation and vascular supply, in addition to the limited soft tissue coverage. Moreover, it is constantly exposed to mechanical stress during walking. This creates an ideal environment where inflammation and infection can persist, and again, healing is delayed. Therefore, in this case, we developed a multimodal approach. So, first of all, we did surgical debridement to precisely remove and excise all the sloughed, devitalized tissue and reduce the bacterial burden as much as possible. Then, we came to laser therapy. So, the patient underwent 12 sessions over 8 days using lasertronics technology, which is thought and believed to stimulate cellular activation and metabolism, reduce inflammation and cytokines, and it also reduces edema and pain signaling. So next up, we came to dressing. We used 2 advanced types of dressings. So first of all, we had the Aquacell AG Plus Extra, which provided an excellent antimicrobial control as well as an exudate control. Then on top of that, we used an additional layer of dressing using the Aquacell foam covering. So this, through its protective foam layer, provided an excellent protective barrier against external trauma and friction. And of course, it provided a moist environment, excellent for healing. Overall, as you can see in the picture on the right here, the results were highly encouraging. So this patient and the ulcer progressed to complete healing without signs of recurrence or persistent infection. And again, as a take-home message, what I mean to say is we do not need to depend in such wounds on a single management protocol. Instead, we used multimodal therapy, and through synergy and perfect timing, we can achieve great results. Thank you, everybody.
Thank you, Dr. Marwan.